and welcome to the Ikigai webinar series. Looking forward to this evening, guys.
Evening all.
Evening.
Just to let you all know as you're coming in there, because I keep getting emails asking for the discount code. So I'm ahead of time this evening and I've put it into the chat. So you can take that, and I've also put the website for the shop. And just as you are coming in, just to tell you that we are going to be having a Pecha Kucha event in a couple of weeks' time, where we're going to be just raising some funds for Tanzania. So we're going to have about 8 topics, all different ones, going to be kind of different. Mainly our colleagues, actually, and they have to do a little presentation, and they've only got 6 minutes, 38 seconds. So it's 20 slides and 20 seconds per slide. So they're really up for it. And then I've just decided today that I'm going to put the judges under pressure as well, that they've only going to get a minute and a little bell, because they can't be taken all the time either. So
a minute, that's quite quite hard, isn't it?
Yeah.
That'll be really good. That's on the 19th of December, Siobhan, is that right?
The 19th of December at 7:30. Well, we'll remind everybody of it anyway. And what's really good is Bridge to Aid are going to come on, and they're going to describe a little bit about the work that they're doing out in Tanzania. So I think that'll be really nice.
Lovely. Yeah, it's not long now until we go, so exciting.
Hey, good luck. You're keeping me company in a spooky house in Kelso, is it?
Ah.
It's Kat, not Catherine. Hi, Kat. How are you?
I was like, who's that?
No.
Being Catherine
scared.
tonight.
So you're very welcome, Lauren and Ibs. Delighted to have you here this evening, this very important subject. You're both volunteers for BADT, and you're both NSK Ikigai educators. Ibs, I know you've implemented dental therapy into every practice that you've worked in, and even though you've relocated, they've continued that therapy practice in their practices, which is pretty amazing. I think for Lauren, you know, I know a lot about you because I've worked with you for quite a few years now, but I don't think maybe a lot of people know that you're a clinical director for one of the groups that has 16 practices, and most of them are therapy-led, which is quite remarkable, isn't it? And I know you're going to explain, obviously, that's what this evening is about, and you're going to explain a little bit more about yourselves. So I'm going to hand it straight over and take it from here. Thanks very much.
Perfect. Thank you, Siobhan. So as Siobhan said, tonight we are going to be talking about dental therapy in private practice. So we're going to talk about how to, first of all, initiate it, how to then integrate it well into the practice, and also how to get everything flowing really well, working really well, optimize your output as a therapist. Okay, so as Siobhan said, my name is Lauren Long. I've been a dental therapist for a long time now, I think 16 years, something like that. I am lucky enough that I found a really nice practice that I've worked in for 12 years. We have always been therapy-led. So for the last 12 years, I have been carrying out exams. I'm working under a therapy-led model. As Siobhan says, I also function as clinical director for a group of practices, which we have 16 practices, most of them therapy-led, everyone working to their full scope, even if we're not therapy-led. This is my passion, is trying to get therapists working to their full scope of practice and trying to get practices to support therapists in doing that as well. And I'll just let Ibs introduce himself as well.
Thank you very much. So my name is Ibrahim Numan. Everyone refers to me as Ibs or Ibby. I have qualified about 6 years ago now from Eastman Dental Hospital. And I actually started every job I've worked in, a little different to Lauren. I applied for a hygienist role. And ended up working as a dental therapist and adding on to my skills in the practice. It's been a long old road. So me and Lauren and a lot of the therapists out there have a vision of getting more dental therapists to do more dental therapy, especially with a lot of the obstacles being lifted nowadays. So we'll talk to you about that and go from there.
Perfect. So I am going to kick us off. So our aim for tonight is to talk about how to introduce effective protocols to maximize use of dental therapists in private practice, to allow us to use our full skill set. And that is obviously mainly for the benefit of our patients, but also for the practice and the whole team. And we're going to talk about the scope of practice and the skills that we have, and talk about how to initiate change within a dental team, and talk about how to integrate ourselves to our full scope of practice. Communication, you'll probably hear us say the word team and communication a lot tonight, and probably one of the most important aspects of all of this. And we're going to talk about the benefits within private practice and how to navigate any challenges, which I'm sure we've all come up against in the past. All right, so I'm going to kick us off with how to initiate things. So this is, if you are working in a practice, you're not sure how to get started, we're going to talk about that a little bit just now. All right, so I think to understand where we are now, we have to understand where we've come from, right? So a lot of people, even within the profession, think that dental therapists are quite a new thing. They think that we've maybe only been around for a few years. However, we have been around since 1959. So, how many years is that? What, 60 odd years, 65 years, something like that now. So we've been around for a long time. We were, however, called dental auxiliaries at the start. 1979, we changed our name to dental therapists, as we're still known today. At the start, dental therapists basically just worked in community care and providing only the dental therapy scope of practice. In 1983, we had combined hygiene and therapy training. And in 2002, we were finally allowed to work in general practice. So this is where I think the misconception comes from, that it's quite a new thing, because we've only really been working in general practice for 22 years. So, in the grand scheme of things, that's quite a short time, really, in the history of dentistry. In 2013, we got direct access, which is obviously where patients can come and see us without the need for a prescription from the dentist. We're going to talk a bit about that tonight and the differences between that and the referrals. And finally, in 2024, we had another piece of the puzzle that allows us to work more effectively in practice, and that is the exemptions mechanism, which is now available to us once we have done our training, to allow us to use certain prescription-only medicines without either a patient group direction or a patient-specific direction from a dentist colleague. All right, so I'm sure we're all well versed on the scope of practice, but in case there's anyone on here who is maybe not a dental therapist themselves or is not fully aware of exactly what we can do, we can do a full clinical examination, including prescribing and interpreting radiographs. We can take records, including digital scanning. We can diagnose and treatment plan within our competence. This is something that can sometimes cause a bit of confusion as well, even amongst ourselves, not knowing what exactly we can plan, but anything that you are confident and competent to plan and that is within your scope of practice, you can go ahead and do. You can use local anaesthetic. Obviously, we've just said we now have the exemptions mechanism. So prescription, PGD, exemptions training, we can use local anaesthetic for our patients. We can remove caries, direct restorations on primary and permanent dentition. We can do direct composite for cosmetic purposes, tooth whitening under prescription, and we can also refer onward to fellow professionals for treatments that are outside of our scope, which we'll talk a little bit more in depth about later on. Okay, so let's talk about finding the one, okay? So you will all probably, if you're a therapist who has tried to implement your full scope of practice in a practice, you probably, we always say the old saying, you have to kiss a lot of frogs before you find your prince sometimes. And we've probably all been there where we have maybe a few pieces of the puzzle, but not all of them to bring this all together. So things that, myself and Ibs came up with that we think are really important in finding a practice that is good for you, good for your patient care, and good for the whole team. So team culture, first of all, I think is a hugely important piece of the puzzle. We need the team to be on board with this. And again, we'll go into more detail about this, but the team need to know what your job title actually is. They need to refer to you as a dental therapist. They need to be on board with you utilizing your full scope of practice. Equipment, we want to have equipment that works, that lets us care for our patients well. Patient base, depending on your patient base, can depend on how much potential you have in a private practice. Approach to patient care from the team. Growth opportunities for us, are they willing for you to go off and do further education? So we'll talk about further education as well, but are they willing for you to go and do that and then to maybe add more treatments to your armor, things like cosmetic treatments? Are you going to have a good work-life balance? So it's all well and good implementing all this, but are we going to, you know, work ourselves to the bone and feel burnt out after a couple of years? Remuneration is absolutely important. There can sometimes be a bit of a, you know, people sometimes shy away about speaking about remuneration, but we need to be paid well for the work that we do, because it is hard work. You know, I am a big believer in that if we are doing a treatment and the dentist is doing a treatment, we should be charging exactly the same. We should be remunerated for it as well. And support from the team is huge. All right. So preparing the team for implementing your scope of practice. So clarify your scope with the entire team. You know, sometimes it will take, you know, you might just need to do a little kind of almost like a lunch and learn with them, you know, get everyone together, bring some biscuits, whatever they like, get them just to sit and listen to you tell them about what a dental therapist can do, because often, like I say, even within the profession, there's sometimes a misconception about what exactly we can do, what we can treatment plan, what needs to be, you know, sometimes they think, you know, we can only maybe treatment plan perio and we can't treatment plan restorations, things like this. So make sure everyone is on the same page to start with. Make sure they're calling you by the correct titles. So like I've said earlier, you know, if you've been employed as maybe on your hygiene scope to start with, you know, the team may have been referring to you as a dental hygienist. It's really important for your patients that the whole team, so from dentists, nurses, reception, everyone, treatment coordinator, whoever you work with, needs to call you a dental therapist. I actually do know someone in the profession that I knew from university who actually got in trouble with the GDC for this, because he was obviously carrying out full scope restorative work and carried out some direct restorative work on a teenager. Parent teenager went to reception to pay. Reception called him a dental hygienist to the mum, and she then reported him to the GDC because she thought he was working outside of his scope. Obviously he had done nothing wrong, but apart from potentially not explain well to them, you know, what his scope was, but he just got a bit of a rap on the knuckles. But it's just, I think, a lesson to us all and a reminder just that, you know, we need to be really strict with this with the team. Diary management. So what can be booked in and where in your diary? So personally, I like to work with having treatment slots. So slots for maybe new patients, restorative work, you know, more complex perio treatment, things like that. What can they book in with you as well? So, you know, reception, being able to triage things. So, you know, does this person sound like they have an irreversible pulpitis? Maybe they're going to be better with one of our dentist colleagues. Is it something, you know, involving, you know, endo, ortho, implants, all these kind of things? They need to know that that's not within your scope of practice and that it needs to be booked with someone else. So discuss transition of care. So really robust protocols are really important. So co-treatment planning, are you going to treatment plan some of the cases between you? So say you see a patient and you have some things on there that are outside of your scope. How are we going to deal with that? Are the dentists going to see the patient for a separate exam? Are you going to take all the records and then assess together? How are you going to refer patients to your colleagues as well? And how will patients be educated about your role? So, you know, are you going to have some kind of literature to give them? And personally, I quite like to tell them myself, you know, this is what my scope of practice is. This is where it begins. This is where it ends. If there is anything that is out with my capabilities and my scope, I will refer you on to the dentist colleagues. So they just need to know that they're getting really well looked after and be clear on what your remit is and what's not. Feel confident yourself. So obviously, if you have not maybe carried out your full scope of practice for a while, it may be that it's baby steps to start with. It may be that you want to go and do some courses and some learning before you feel confident to jump right back in. So I would suggest researching some courses to attend to increase your skills and your confidence. It doesn't have to be, you know, so you don't have to spend loads of money at once. You know, I wouldn't say, you know, do 5 courses and then start, you know, you can ease yourself into this. There are other ways to learn. Shadowing others in the practice is a really, really good way to learn. I feel sometimes that I will learn more from that than going on courses. Shadowing colleagues, I think, especially if you can shadow multiple colleagues, everyone works differently. You know, you will always learn something from an afternoon sitting in with your colleagues. You might work with other dental therapists who are utilizing their full scope. You know, ask them, can you shadow them? Ask, can you shadow your dentists as well? And you'll learn absolutely loads. Practicing on typodonts is actually a good way as well. You know, you can get typodonts on Amazon for like about £40, something like that. Just practice, especially with your kind of cavity preps, your matricing skills, things like that. It's a really good way just to practice. If you're like me, whenever I graduated, so 16 years ago, you know, we didn't have sectional matrices, anything like that. You know, we were using Toffel-Myers, sequevalents, all these things. So we didn't really have sectional matrices. So my first introduction, like years and years and years ago, to this was a dentist showing me on a typodont. And then I've obviously done courses and things since then and started to utilize those in practice. But things that are new to you, you know, have lots of goes on typodonts and see how you get on. Reach out to your colleagues for tips and advice. So, you know, say if you're going to be carrying out exams, which you've not been doing before. I know there's been lots of questions online about this recently as well. Reach out to colleagues, you know, ask questions to people that are doing this, you know, try and ask people, you know, do you have a set regime that you go through when you do your exams? You know, what kind of records are you taking? What order do you do things in? And again, just learn from others. And discuss with the practice what kind of treatments you are comfortable with. So, you know, if you're starting out, if you've not done it for a while, or if you're newly graduated, and you don't feel particularly confident in, you know, more kind of complex restorations and things like that, or cosmetic work, you know, you might just want to make an agreement with your dentist. What can be quite useful that we use in some of our practices is to get them to grade the restorations. So, you know, something like an occlusal might be like a grade A, then like an MO and a DO might be a grade B, so on and so forth, kind of progressing up to the kind of subgingival deep margin elevation type cases that you might then get more comfortable with as you get better. So you might want to say to them, you know, do you know what? I've not done this in a long time. Please just refer me occlusals to start with, and then we'll progress from there. And, you know, check in with each other every so often just to make sure that you are, you know, you're learning, you're growing, and and let them know when they can then send you things that are more complex. All right. And on that note, find yourself a mentor. I find this, you know, invaluable to have somebody, or it can be multiple people. I would say for me, it's probably multiple people. So it doesn't even have to be in person. You can do these kind of things online. So if you have someone that, you know, someone that you think you admire their work online, you know, someone that you work with, someone that maybe works in a different practice to you, but is local, you know, ask them for tips and advice. Mentors should really be someone who is accessible to you, as I say, whether that is in person or online. They should be knowledgeable about the topic that you're trying to learn about. They should be motivational as well to you, you know, so they should really believe in you and want you to grow. And they need to be patient because they're going to be helping you, okay? Reliable as well, so say accessible and easy to contact and actually want to help you out. Current with their knowledge too, so, you know, really up to date, looking at the evidence and knowing what the latest techniques and developments in dentistry are. They should be honest with you, so, you know, you should be able to show them pictures of your work, and they should be able to give you honest feedback without them feeling bad or you feeling offended. They shouldn't judge you. So, you know, if something maybe doesn't go quite as well as you would like, you know, they can give you feedback, they can help you, and they can say, you know, maybe next time this will be a good thing to do. Empathetic as well. So someone that's a listening ear, so you can go to them, talk to them about, you know, maybe if you have some anxiety around doing certain treatments, any hesitations. And like we said, lots of times helps you grow. You know, they really should have your best interests at heart and want you to progress and develop and fly in your career. All right, so I'm going to pass over to Ebbs for the next section.
Thank you very much, Lauren. So some great points made on how we could initiate dental therapy. How do we now spread that into practice and start integrating? So two modes of working for dental therapists. We have referral versus direct access. So if you work in a practice that works with a referral system, the patient sees a dentist for a new patient exam, routine exam. Dentist carries out the clinical assessment and treatment plan, refers to the dental therapist for some or all items within treatment of scope. Therapist then carries out treatment, not possible to alter the treatment plan, and then patient continues routine care with exams by dentist. Now, if this is a system that's in a practice that you're currently working in, and this is how the dentist would like to work, there is a few little small obstacles here. The most common one being if a dentist was to refer you a lower left 6 DO caries. As silly as it sounds, if that caries was to be an MOD when you access the cavity, that's now a change of a treatment plan and a change in a referral, so therefore you can't go ahead to do it. So the easiest way to overcome that is the referral to be, can you please restore the lower left 6? And not give us a specific site, if you like, to that area. You may find that you're working in a referral-based practice, but you'd like to implement a therapy-led practice, which we'll move on to, and working on the direct access as well. So the patient sees the therapist first without seeing a dentist. We carry out the full examination, including radiographs and reporting on the radiographs as well. Therapists then treatment plan all items within their scope, refer to an appropriate colleague for items outside of the scope, and carry out all suitable treatment within the scope. So you could see it's exactly the same thing. The patient gets exactly the same chair treatment, should I say, and it's just literally flipped on its head. And the nice thing about working under this system, which is the system I currently work under, is the fact that the patient actually feels quite special, I find. If a dentist is saying, oh yeah, I need you to go see someone and come back, but if you say to the patient, oh, actually, this is quite interesting, I'm going to get a different opinion here from a dentist, this is outside of my scope, that patient feels quite special. And you bring someone in and you discuss that case together, and it's a really nice way to build a patient's trust, especially if that's the patient's dentist as well, because they could see you working together. And it's all about building trust and rapport with patients at first. So. Okay, so as Lauren was saying, still we have difficulties with dental nurses, receptionists, colleagues of our scope, so we can't expect patients to have any idea of what a dental therapist is. Every time I introduce myself, I will get a raise of the eyebrows, and I will make it very, very clear what my role is and what I am there to do, and what I can't do as well. So I never like to give oh, this is what you should say and what you shouldn't say, but you should definitely include a few things. One of them being, obviously explain that a dental therapist are trained professionals who work alongside dentists to provide a range of dental care services. Then I would go on and say, outline your responsibility. So something like dental therapists can perform routine dental procedures, such as hygiene visits, fill-ins, and preventive care. We focus on patient education and helping maintain oral health. So a little spiel like that tends to work really well. Briefly mention training. For example, dental therapists have specific training and education that allows us to work effectively in dental settings, often having completed a degree or diploma in dental therapy. You know, a lot of, there's some universities, I think it's Liverpool, that dental therapists actually do their first year of undergrad with undergrad dentists as well. So, you could say, if that was you could say, look, I trained alongside dentists, they stay on and do an additional 2 years. We need to remember that patients that have never heard of this term. So as silly as it sounds, mentioning your qualifications is a way to build trust from patients. The benefits, highlight the benefits, as I was saying earlier. Seeing a dental therapist, you could explain, having a dental therapist on the team allows for more efficient care, as we can handle many of the routine tasks. Let the dentist see you for the more complicated things, and it leads to shorter waiting times and personalized attention, which is a huge, huge benefit. So it may come across as a shock at first to patients, but actually I have never had a patient complain about the approach that we take in any of the practices I've worked in over the last few years. They will always doubt, because at the end of the day, a patient walks into a dental surgery and all of a sudden there's 4 hands in their mouth. They feel quite vulnerable. They've never met you before, which is why I think the therapy-led approach works really, really well. If you could introduce yourself through dental examinations, instead of a patient just coming to see you straight away for you to do treatment straight away, it gives you that opportunity to build a rapport and build the trust. And obviously reassure, advise the patient that they will of course still see their dentist and continue to receive any more advanced care that they may require. Discuss how you can refer them onward if any treatment falls outside of your scope of practice. Lauren,
right,
into your beautiful sides.
We are going to go through some different modes of working that can be implemented into practice, okay? I will preface this by saying that, you know, there is no one protocol that we can give you that is going to work in every single practice. It's going to depend on, you know, how your practice is set up and the system in which you're working under, you know, whether you have planned patients, all these different things. So again, it's for you to discuss with your team, but these are some ideas. All right, so this is what I like to call the traditional. So this is our, you know, standard, what a lot of people are doing up and down the country. And we may well be dental therapists, but we are working just under hygiene scope. So, you know, you have your, we call it the H30, you know, the H30, 30 minutes, 30 minutes, 30 minutes, all day, every day. You might well have a double appointment, you know, if you're doing some perio treatment, something like that. And sorry, someone has just come in. Sorry. You might have 30 minutes, 30 minutes, 30 minutes, and you are getting paid the same for every single section. You're getting, you know, this kind of set amount every 30 minutes. And if you're doing that, you are working to about 25% of your dental therapist scope of practice. All right, so we want to do more than that. Hopefully we want to grow. So what we are then going to do is add in some routine restorative treatment. So this might be when you are starting out, you might add in some kind of basic direct restorations, okay? So like we spoke about earlier, if you just want to start off maybe doing some occlusal restorations, maybe some class 2, something like that, this is how we can then increase our how much of our scope of practice that we're using, and also increase the revenue for the practice. There are some example costs down the side here, okay? Just examples. I realize this will completely vary up and down the country, so you can have a little think of how this might translate for you. If you're doing this kind of thing, you're using about 65% of your dental therapist scope of practice, okay? So we're getting there, all right? We can jump by 40% just by starting to do some restorative work. This is the system that I work under. So this is where routine exams, perio treatment go in the therapist schedule alongside some restorative treatment, okay? So instead of having just your kind of standalone perio or hygiene visit, you might have an exam coupled with the patient's routine visit. You then will have some restorative work, some more complex periodontal treatment. So again, using your full scope of practice, using your periodontal scope of practice as well, but charging appropriately for that. So you'll see just that the revenue starts to increase as well for the practice, and you're then using 100% of your dental therapist scope. Some dental therapists have done some courses that will then make them feel confident and enable them to carry out more routine and cosmetic restorative work. So this will often happen via direct access. So maybe seeing patients that have come in without seeing the dentist, like we said, they're then going to treatment plan themselves, maybe carry out things like composite veneers and whatnot. Obviously, for whitening, you will still need a prescription from a dentist, so you may well need to involve them at that stage. But things like your direct restorations, you will treatment plan yourself, you will carry those out, and then you may also be doing, like we say, cosmetic work. Again, that is 100% of your scope of practice. But doing these more kind of advanced treatments, you will then increase your revenue as well, okay? What about the dentists? This is always the question that props up when we talk about this. You know, what about the dentists? Are they going to lose out on treatment? You know, what happens when they start to give the exams over to the dental therapist? What happens when they start to give the restorative work over to the dental therapist if you're working on a referral basis? What happens is you're lifting these kind of, you know, 20-minute, whatever it is, exam slots out of their diary. You're taking these direct restorations out of their diary. Maybe they want to hand the whitening over to you as well. And what it enables them to do is actually grow and follow their passions as well. So they might like to do smile design, porcelain work, ortho, implants, endo, whatever it is they like to do. They can then progress, do that, and again, increase their own production and revenue as well. So, you know, to me, it's a no-brainer. What I would suggest is if you are struggling to get your team and your practice principal on board, is to suggest that you trial this for a period of time. So I think 3 months is usually a good period of time to try and implement this, see how you go. They will, without doubt, see the revenue of the practice increase, which is, you know, money talks at the end of the day. And anyone who I've helped to do that, they've never gone back again, you know, and all our practices have done the same. So if you're struggling, then that is where I would start. All right, so over to you, Ibs.
Thank you very much. So, very simple question, but we get so caught up sometimes in that H30 life that Lauren was talking about. Are you in any pain or discomfort? Or do you have any complaints? Do you have any concerns? Is a question where patients will normally answer no to. However, if you then follow that up with, are you happy with your smile? It really, really can open up a huge scope of your dental therapy. So when I first started working alongside one of my mentors in Fulham 5 years ago now, I actually started off with asking these questions, and a lot of the time it was such an easy fix. It would either be, I'd like my teeth to be whiter, or I don't like the appearance of this tooth, there's a big brown spot on it, I've got a really small fracture or a chip here. And you just dive in and you could take on that work, obviously, if the principal discussed with the principal dentist as well. But what that allowed me to do coming out of uni straight away and jumping into that was just get comfortable handling composite materials, mastering my polishing skills, manipulating composite, you know, building up really nice class 5s even incisal fractures, and just perfecting that and giving myself some confidence to move forward and then do the more complicated class 2s and MODs and etc. So it's a really good starting point to just tweak and think about, after you've introduced yourself to the patient, just think about the questions that you're asking these patients, because it can really open up the scope for a lot of work for you to carry out. Okay. Seems that I've got a bit of a delay here, sorry. Here we go. Okay, so directing care, very, very important. We, as dental therapists, can refer on for an implant dentist, a smile design dentist, an endo dentist, an orthodontist. I think that the value in that is so, so high. I mean, I moved to Brighton and relocated about 4 years ago now. And I knew no one in Brighton, obviously, but the power of social media and meeting some people along the way has really allowed me to refer on treatment, but for them to then refer on treatment to me as well, which is lovely. I had a patient not so long ago that I referred to an endodontist for trauma on the upper central, where they did root canal treatment followed by internal bleaching, and then sent that patient back for me to do the composite restoration, which was lovely. And same with an orthodontist. I refer on to ortho all the time, especially NHS. Patients are sent over, and with that, when treatment is complete, any white spot lesions, icon white spot removal is great, as well as black triangle closures. It's very common for adults that have fixed braces. So, you know, these are all treatments that then come back. So you almost build up a little community in and around your practice. Now, you may be fortunate enough to have these people working in your roof, and then under your roof, should I say, and that's even a huge benefit, because you could literally pop in and get an opinion from them, or they could pop down, etc., into your surgery. So it's all about building a community and a multidisciplinary environment, even if you don't work in a multidisciplinary clinic. Perfect. So directing care, I'm going to go through some cases, and I'm actually going to speak through some of Lauren's cases here. We have a direct composite and periodontal treatment carried out with a therapist, and the extraction and the porcelain onlay was referred to the appropriate dentist there, obviously. So we got lovely before and after shots there, and you could see how easily that can work. You know, you want to get the gums nice and healthy first, then move on and do your restoration, and move it on to the dentist to carry out the extractions and the onlays and the porcelain and direct restorations there. That's a lovely picture, by the way. Things like that get me really excited. I'm not sure why. Weird. But look at the amazing results as well. And to be a part of that in a patient's journey, and to have the power of, which we'll talk about photography in a moment, but to show them the difference is amazing. And you can see that Lauren carried out the periodontal treatment and then direct posterior restorations as well. And then we have the extractions and denture and eventual implants with the dentist. But I think that's really, really nice results there. And I bet that patient was over the moon. And then, of course, you know, whitening in this day and age, the TikTok era, as I like to call it, everyone wants to have really nice white teeth, bright smile, and there's nothing wrong with that. And that is well within your scope to do as long as you've got the right referral. And a small fracture repair goes such a long way. I always find the small little tweaks that you do in the mouth make such a big difference. And I'm sure this patient was also very, very happy after the referred for an implant as well with the appropriate dentist. Okay, the power of photography. Briefly mentioned it there with Lauren's great pictures. The photos that you take doesn't only need to be for you to be sharing with social media and everything else. I think the power of taking photography as routine to critique your own work is absolutely brilliant. I started taking pictures immediately after qualification. And it's really nice to look back at those and see, you know, how much I've evolved, because I think it's normal for us to always have a little bit of imposter syndrome at some point in our careers, or some days even. You know, not every day goes to plan. Not every day is going to be Instagram worthy pictures, but that's just dentistry. And I think that's why it's such a challenge. It's never always predictable, but the more you do something, the more predictable it becomes. So it's a really good way to track your progress and improve over time. And I highly, highly recommend, you can start off on the phone, but I highly recommend the cheap DSLR camera, which can be purchased online. You know, secondhand refurbished cameras are not expensive at all. We will have our details at the end of this slide, at the end of the presentation, where you could just drop us a little message and I'll talk you through some recommendations. You could get some really cheap twin flashes on Amazon, etc., and go from there. So the power of photography is absolutely huge, and it really does enhance patient engagement. So before I go on to talk about that, this patient is one of my patients I did some direct composite veneers on. She's a lovely girl, but she had quite a bit of dental phobia. She won a TV show on ITV, and she does a lot of singing now. And she was very conscious of her smile, and the first thing she wanted to do was improve her smile, but she refused to go through Invisalign. So she made my life absolutely hell. She didn't even let me floss at first until we got her to this stage. And I absolutely love the results because there's so many challenges that we overcame for her here. The only thing I hate is the lipstick mark on the upper right tooth that I just can't get rid of. But anyway, we enhance patient engagement with this, and you know, along the way with cosmetic work especially, I find patients become very, very particular. A very good way to gauge whether you'd like to do some cosmetic work to a patient is how close they hold the mirror to their face. So if you hand over a mirror to a patient and ask them what would you like to change, and they bring the mirror right up close to their face and they say, oh, there's that little area, that's going to be a very challenging patient for you to be able to meet their expectations. So you may want to think about that. But what it does do with your before and after pictures is that you can show your before and after pictures, especially when it's such a big transformation to your patient. So if they're unsure of their smile, and I'm telling you now, I have done, fortunate enough to do a lot of smile makeovers. And I mean, the Instagram videos are amazing online, don't you? See them passing over the mirror to the patient and the patient starts crying. Majority of that is staged, unfortunately. A lot of the time it comes across as a bit of a shock to patients. They're unsure, it feels big, it feels bulky, it's nothing like their own mouth and what they're used to. And it always takes a little while, and they come back for their review appointment and they say how much they love it, which is amazing. But a lot of the time the pictures work really, really well. And what I normally do is leave the before picture up on the screen when I pass them the mirror so they remember what it was like, and at least they could see the improvement. So increase the practice visibility as well. You know, tag your practice up as well on your Instagram, on your socials, whatever it is you might be using. Obviously ensure that you get your consent for these photographs to be shared in the first place. It builds trust. You know, if I I use an intraoral camera as well. You know, if I see a lesion in the mouth, a cavity in the mouth that a patient is unaware of, taking a picture of that, showing that to the patient and saying, look, this is what I've taken a picture of today. This is what it is. Here's the x-rays to go alongside it. Here's what we plan to do. Here's what we recommend. Here's your treatment options. So it's really, really powerful, and it does attract new patients. I was very fortunate from just this case here to then get loads of referrals for many more patients. And it's just all about showing off your work. And there's always going to be Instagram police, and that you're always going to be very self-critical of your work. I could look at that picture and pick out so many things I don't like about that smile. But if that patient is happy, that's all that matters. And obviously you could promote oral health education, you know, even small things like disclosing patients and showing the difference in the gum health when you take pictures after you've done some hygiene treatment and after the patient has taken on your oral health advice. It makes such a huge difference. So highly recommend dental photography. And like I said, please get in touch with us if you're unsure where to start. It all comes down to confidence, and I find knowledge is power. And further education is something I definitely recommend. I know Lauren did her postgraduate diploma in restorative and aesthetic dentistry a while back. And I actually just completed and graduated with mine last month. And I did that with the Smile Dental Academy. Tipton Training also offer a level 7 certificate in restorative and aesthetic dental therapy. Siobhan does the postgraduate diploma in oral and positive health. Monique Vassant, Fresh Dental Institute, also does a postgraduate diploma called Totally Therapist. Again, it's very restorative and aesthetic based. Rena Wadia does a postgraduate diploma in periodontics for hygienists and therapists. Portsmouth University has now rolled out an advanced restorative dental therapy top-up for an MSc. University of Essex has the advanced periodontal practice masters, and UCLan has dental studies, which provides a top-up. So if you have a diploma, you could upgrade that to a degree level if that's something you're interested in doing. Find your passion. I knew that when I left university, I wanted to do therapy. Was I confident in doing therapy? Absolutely not. But slowly started implementing it. Like Lauren said, you know, very small areas here and there that we started getting some patients, doing some small occlusals and implementing some dental therapy and building your confidence. But the most important thing is, are you happy with the work that you do? We spend more time at work than we do at home. So it's quite important for you to be happy in the work that you do. So is it cosmetic dentistry that you want to get into? You know, do you want to do composite bonding cases, edge bonding cases, teeth whitening? Is it periodontal disease? Do you enjoy periodontal disease? Is that something you'd like to do? Pediatric dentistry, you know, that is another great gateway to introduce dental therapy into your scope. Because a lot of the dentists that I've worked with hate seeing kids. So they will be more than happy for you to take on pediatric care if that's something you're interested in. And it's actually very, very rewarding. I do quite a bit of pediatric care at the moment. Or is it restorative work? Do you want to make beautiful posterior restorations with beautiful cavity preps? And is that what your passion is? And, you know, just find what it is. I think there's a lot of talk about the obstacles that we have in dental therapy. And there's so many hurdles, but a lot of those hurdles we've overcome. And yes, of course, we'd like to add to our scope in the future, but I think we've come such a long way. We are very fortunate to still have quite a lot of options in what we can do. And we're very fortunate to work in a career that we work in, where we could kind of pick and choose the things we like to do, if that's a practice that you're working at with multiple disciplinary areas, for example. So, that's my advice moving forward. I think you need to just find your passion and go for it. And like Lauren said, 3 months trial period, and you will convert others as well.
Brilliant. Thank you very much, Ibs. So these are our details on Instagram. If anyone wants to ask us any questions, needs any support, please just get in touch. We will do some questions in a moment, but if there's anything, you know, you don't feel comfortable asking, or you want to, you think of it afterwards, anything like that, please just find us on there, and we're more than happy anytime to answer some questions. All right. And just thank you to NSK and Ikigai, obviously, for having us tonight. And I will, I say Siobhan's put the discount code for the NSK shop in the chat as well. So please utilise that if you would like to. And I will pass over to Siobhan. She's going to go through some questions if there are any.
Thank you very much, Lauren and Ibs. I think it's important to, to talk about the day courses that you both run, you and Ailish Duffy and Kat Edney run. I'm not too sure about other day courses that's out there. Just sometimes a day, a day or two to dip your toe in and even chat to your colleagues, as you were saying earlier, I think is hugely important, isn't it?
Yeah, absolutely. So there are courses run by dental therapists for dental therapists out there. So Kat, who I think is on, runs the Modern Therapist course, and then myself and Ailish run the Restore course, which is a reskill course for dental therapists as well. There are obviously also courses run by dentists that you can attend as well. So I would say if you're starting out, just have a really good look around and see what's out there and see, read the aims and objectives and see what kind of chimes with you. As Ib says, it's finding out what's going to be your match. There's no right answer for everyone. So have a little look about.
Brilliant, yeah. Kat's put another one on there, Avant-Garde Emily, a therapist.
Yes, that's right.
Well.
Yes, so Emily Roscoe runs the Avant-Garde course and the therapist course as well, digital therapist. So that's an amazing course as well. No, I think Ibs, you've done that one, haven't you? So that one is a really good one to go on to.
It's great, especially if you're interested in cosmetic dentistry. I'd highly recommend starting from the digital side before moving on to freehand, because it gives you a lot more confidence and guidance as well. So that's a great course. Yeah.
And Kat Edney's course is really good. She does a lot about the matrices and things like that, so that's beneficial, and a lot more because she does a lot about implementing therapy into practice also. Just tell us a little bit, if you haven't done this for a while and you're kind of feeling a little bit nervous, where do you start then?
So I would say picking up a high-speed handpiece probably if you've not done that in a while. And like we said earlier, even on a typodont just to start with, just to get the feel of it again, because it's a bit nerve-wracking when you first pick it up again. If it's been, I've had people that have come to me that have not done it in 10, 15 years, something like that, maybe not since they qualified. So it is like riding a bike. You do get back into it quite quickly, but it is getting the feel for that handpiece, working on your handpiece control, your cavity preps, all these different things. Again, if you want to go on a course, there are lots of courses that will cover all of that, but I would say just get it in your hand and have a go with it and see how you feel.
Thank you. Somebody's just asking for a recording because they want to show their dentist. So I think that's important, isn't it?
Yeah,
because
absolutely.
Yeah, the dentists, sometimes they just don't understand themselves, do they? So let me
just
see.
Stop sharing 2 seconds.
Okay.
And let me do it. Go.
If I do cavity turns into an MOD, if a DO cavity turns into MOD, do I have to get dentists to go ahead before continuing? Or could I just go for it and justify doing the MOD as following the care, isn't it been within scope? Or even say mesial part is DA direct access?
Yeah, I mean, look, if you're working under the referral system, this is exactly what I was mentioning earlier. It's really good for you to try to avoid the old side of things and getting the referrals at specific sites, because we actually don't know what that cavity is going to look like until we go in there. But at the end of the day, and this is my opinion only, and I've spoken to many other colleagues that completely agree, including dentists, that patient's care is your responsibility. And I think that you need to do what's best for that patient in that time. So absolutely, if that is a DO cavity that spreads into the mesial, then you can't just ignore it, leave the caries there, or expect the patient to come back and just temporize. I would deal with that there and then discuss with the dentist after and find a better protocol for referrals to avoid that happening again.
Yeah, I agree. I think it's about setting your protocols up at the start, isn't it, Ibs, when you start, doing this and speaking to your dentist about what happens in that situation. So
absolutely.
Another person just asking, can they get a recording of tonight? Yes, you can. We normally do it in about 10 days time. It'll be ready on the My NSK and we can let you know about that. Any more questions there? Any other advice that you can think of, both?
Don't be scared to get stuck in. I know I was very, very scared. And I would say just go for it. I remember my first occlusal on a lower left 6 in practice. And it was a freezing day and I was absolutely sweating. So lucky that we wear masks, don't we? Because they can't see your facial expressions. And I think I called my principal dentist in to check my occlusal cavity about 3 times. And it felt normal because I just qualified at the time. And, you know, you'd always get your tutors over at university to check something. But there's nothing wrong with you doing that and getting an opinion. The patient is definitely more likely to respect you more if you say, oh, actually, I've just noticed something. I'd just like to get an opinion. Just bear with me 2 moments. I think the patient will respect you more than doing something wrong and then coming back with a problem. So don't be shy to get stuck in.
Yeah, I like that wording. Say that again, Ibs, so in case.
What was that, sorry?
You just like to get an opinion. That's nice wording to use.
Absolutely, yeah. And it's always to do with the words that you use, I think. And even when introducing what you can do as a dental therapist as well, it's all to do with, you know, I'd just like to get a second opinion of something I've noticed here, if you just bear with me a few moments. Or, oh, this is interesting. It's a very, patients want to feel special. They want to be remembered. So, oh, this is very interesting. It's quite unique, actually. I'm just going to get another opinion. Anything along those lines. It's not a lie. You are getting an opinion. You're not lying to the patient, and it just gives you that confidence moving forward.
Absolutely. Guys, what do you think to asking for a really experienced nurse for those first steps? They are always so full of help and suggestions.
Yeah, absolutely. I think if you can have an experienced nurse, amazing. Obviously, you know, it's not always going to happen. There are recruitment struggles and whatnot at the minute, but I think definitely if you can get an experienced nurse for things like, you know, having things, because usually if you get an experienced nurse, they've got the equipment that you need there before you even ask for it. You know, they're there with their hand out ready to give it to you. Things like placing rubber dam, all these things, you know, they're so helpful with doing that. So yeah, I would say if you can obviously get an experienced nurse always, you know, for anything really, you know, love having an experienced nurse. Great.
Lauren, you mentioned gaining insights into the routine and the steps of doing an exam. What are your steps in the exam?
That is quite a lot to go into in a short sentence. So I actually have a cheat sheet that I can send. I did a talk at BSDHT OHC a few weeks ago, and people were asking for something, you know, that they can reference. So I have a little cheat sheet that I can send on. So just contact me and I'll send it on to you.
Okay. I had an overseas dentist as a nurse for some time and it was fab. That would be amazing. Thanks so much, Lauren. And then slightly off topic, but how do you deal with referrals that are unsuitable? The rubbish dentists don't want to do themselves, worried about looking incompetent by referring them back.
No, so Ebs, you go first. Go on.
Yeah, I mean, first and foremost, is this the right practice for you? Is a question you might want to ask. That is very, very important. Secondly, make your feelings clear. I think you should tell the dentist about the unsuitable referrals and tell them you're not comfortable doing those. There's like I was saying in finding your passion, it's the same thing with saying, oh, I'd love to do cosmetic work, or I'd love to do pediatric dentistry. But there's nothing wrong with speaking with your principal dentist or the referring dentist and saying, do you know, I don't actually enjoy this. I don't think I'm very good at it. I'd like to develop my skills in it, but I'm just not ready to do this yet, and move forward from there. So that would be my advice.
Yeah, absolutely that. And sometimes, as you say, sometimes it can be things that maybe they're not comfortable with doing themselves as well. And I think when you said, Siobhan, like, what is your one piece of advice earlier? Mine is probably that don't feel like a failure if you can't turn the team, so to speak. You know, so there will be practices that are never going to come around to this way of working. They're not going to get on board. You'll have resistance from the dentist, you'll have resistance from everyone, you know, and just even, you know, a few people resisting can really ruin your experience. So, you know, sometimes it will be seen as an easy route for people to refer you things that they maybe aren't comfortable with doing themselves. So you're you might not be comfortable with them either. Actually, if anyone's been on the Restore course or seen my exam presentation that I did at OHC, I have a slide of radiographs that were referred to therapists from dentists, and some of these teeth are unrestorable. There's about 20 radiographs on there, and genuine referrals that were sent. I just asked around for people to send me their worst referral that they'd received. So don't feel like a failure, because often these, it might not even be doable in the first place. So again, set out what you're comfortable with doing. And if you get something that you think absolutely no way, you're much better to go and say to your colleagues, who hopefully you've got a good relationship with, this is really not within my competence. I don't feel comfortable doing this, rather than getting yourself into a situation where you maybe open up the tooth, the patient's there, and then you're in, so to speak, deeper, pardon the pun, and can't get yourself out of that situation. So I think there's no shame in doing that. And I think we all have to become comfortable with doing that sometimes.
Yeah. Christina said, delighted to have Ibby in practice with us, and I believe our team, Dentist are all on board.
Absolutely.
Well, I think we all want to work there with Christina Chatfield, actually.
Yeah, I mean, I'm very fortunate. Christina's always been very pro-hygienist, pro-therapist. She's absolutely brilliant. And, she was one of the first that made sure that all hygienists have nurses, etc. So very lucky to have her on board. So thank you.
Definitely, definitely. Hi, guys. Great webinar. I'm finding I'm being referred all the 8 buckles, the one the dentists don't want to do, any ideas? So I think we kind of just covered that, did we? Yeah. Thanks both. This was full of information and helpful things I can take back to practice. A therapist covers 72% of what is taught to dental students, so don't ever feel like we weren't good enough.
Yeah, exactly that.
EDS students, yeah. That's
true.
from Zoe. Hi, Zoe. I think that we have just checked. I think we've come to the end of the questions, unless there's anything else, and we're just nearly on the hour.
There was one that just said, can therapists fit a night guard?
Oh, fit a night guard, there was. Sorry, I missed that. Thanks, Ibs.
No worries. So that's a no. You shouldn't be fitting a night guard. You can take impressions or do a digital scan for a night guard that has been referred to you by a dentist, but the fit should always be with the dentist.
Lauren, I think we'll have to get your examination webinar on, because it seems to be quite popular, if you were up for that.
Yeah, why not?
We're under pressure now live. Thank you very much, both. Just what composite edge bonding course did you do, please?
Composite edge bonding, I actually did quite a few composite courses. So I did a lot of day courses, not a particular edge bonding course. I just don't really have a life, to be honest. So I do a lot of courses. I love geeking out. The one that I really recommend is Monique Vassant's Totally Composite course, which is very, very good. But there's so many good anterior composite courses, one-day courses out there. And if you could just do as many as you can, you will pick up one little nugget from each one, and it molds you into your work and the way you like to work. So that would be my advice, absolutely. Just try to do as many anterior composite courses as you can. That will cover edge bonding.
Brilliant. And I think that is it. And I've put the code into the chat because I get lots of emails about that discount code afterwards. Lauren and Ibs, thanks very much. That was really informative. We're very busy this evening. So I know that the two of you are very approachable. We also have Kat Edney, very open to anybody contacting any of the three of you and asking you any questions, I know. So thank you very much. And thank you to NSK Ikigai webinar series. We are back next week with Kat Edney. And then the following week, we have the Pechakucha event. And then we're nearly out for the year. So thank you very much to you both for giving up the evening. Thank you.
Thank you.
Thank you, Siobhan. Thank you.
Just saying thank you both. Thanks.
Thanks all. Thank you for coming.
Just leave the code there for another few minutes, just while we end. Okay, so I'll end it there. Thanks, guys.
Thank you.